someone wanted to know about ophthalmoplegic migraine, and ophthalmo means the eye and plegic means it's weak. So the eye doesn't move properly. And ophthalmoplegic migraine may not actually be a migraine, but it's lumped in with migraine because it often has a typical migraine headache. Ophthalmoplegic migraine can look like a cranial nerve 3 palsy with ptosis and the eyes down and out, exotropia and hypertropia, or it can look like a cranial nerve 4 or a cranial nerve 6, but usually it's 3 or 6, and of the two, 3 is the most common. So it's going to be a chronic, recurrent, and then resolving cranial neuropathy in a migraine patient. The radiographic feature on MR sometimes shows enhancement of the involved cranial nerve, and then that enhancement goes away. But there really shouldn't be any other neurologic finding. You have to work it up, make sure it's not an aneurysm or a tumor or some other cause. It's kind of a diagnosis of exclusion. And so we're going to have multiple recurrent stereotyped episodes of ophthalmoplegia. Can look like 3, 4, or 6, but usually 3 in a patient who has a headache, a migraine headache afterwards. And if the MR is abnormal, it shows enhancement of the nerve that resolves over time. It's a diagnosis of exclusion because you have to make sure it's not these other things. After it starts happening maybe 2, 3 times, you stop working it up and you just call it ophthalmoplegic migraine.